Good afternoon. I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. Our patient travels from New York, and she's here because she's had 30 years of chronic, debilitating lower back pain. Turns out she has two reasons to have back pain. Number one, degenerative disc disease. Second reason, bilateral piriformis syndrome. We're going to start by fixing the disc pain at L4-5, L5-S1. She has two damaged discs, L4-5, L5-S1, causing her back pain. And I'm going to go in, repair both discs. Now, some people get confused about the Deuk laser disc repair. They think that we're going to be making the disc look normal. We never make the disc look normal. It's not possible. This is sub-Q, okay? You got to be under the skin. Let me show you the difference. Sub-Q is deep. You're in the fat, all right? Sub-Q is in the fat. But under the skin, where you want to be, it gives you that orange peel appearance. It's a little bit harder to get. You see that?
Yes, sir. Yeah.
All right? Peau d'orange. Peel of the orange. And let's get started. Shot? All right. I'm going to start at L5-S1. You don't have to have a discogram. If we can, that's great. But don't feel obligated. Hey, if you can do it, that's great. Now, I will tell you, looking at her bone, so you know you're off on the WAG right there. I think she moved a little bit. She has got osteopenia. Oh, no, you got to go. You're off on WAG, my friend. Shot. And while we're getting situated here, why don't you show the audience the 30 different causes of back pain? That's really good right there, Jordan. You're very close to perfect right there. I'm Dr. R. Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk. Welcome back. We have managed to get into L5-S1. Now we're working on L4-5. Our patient has pretty severe scoliosis, and she has pretty degenerated disc. Shot? So I've got to figure out how to get to where we need to go safely. I don't know, Jordan. I think there's something way off on our orbit. Yeah, that's better. Much better. And I don't think that's even perfect. I think we're off on WAG by a degree. Maybe half a degree. Let's see what we can do on WAG. So I'm using an X-ray machine called a fluoroscope. What do you think, Jordan? I'm using a fluoroscope to navigate down to the annular tear that I'm here to fix. That's not bad. What do you think, Jordan? Give me an AP. I feel like I'm hitting the facet. This is the hardest part of the surgery, getting the needle in the right spot. And with her, wait till you see her curvature on the AP view. Watch this. Bam. Look at that. Totally crooked. Curved right towards me, rotated, laterally listhesed, laterally bent. Disc spaces are collapsed. Definitely not an easy case. Too medial. I need to be a little bit more lateral. Shot. I'm going to try to come, because her spine is a little bit more lateral than normal. Shot because of her scoliosis. Shot. Wow. That's amazing. Shot. Shot. You're doing great. Just lay still, Shot. Don't move. I would rather her be asleep than do our discogram. AP, wait, let me see if I can get a little closer to the spine here. Shot. Yeah, she's just wiggling a little too much for me. Shot. AP. Spine is so twisted. Alright, once again, I'm too medial already. I'm barely even put the needle in. Shot. Alright, let's go with the lateral. Shot. Shot. Alright, we're pretty close. Shot. Very collapsed. Shot. AP. Look at that, she's completely closed off on this side. There's no space between the transverse process of L4 and L5. That's interesting. Shot. 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 AP. Again, I'm hitting bone. Yep, hitting the transverse process. Look at that. There, I don't understand. She just collapsed down. She has no space there. Shot. Shot. AP. It's probably the best we're gonna get. Let me see. At least I need to feel. Shot. Any, you've shown the video on the 30 causes of back pain. Shot.
Yes, that's correct.
And shot. All right, let's see where we are. Let's show the videos on how disc injuries cause back pain. Shot. All right.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-692.
Go ahead and show them how the DLDR is done.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A quarter-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Yes?
No, don't take it out.
What do you want?
I was going to go in.
Oh, okay.
No, it's too late now.
One second.
I don't know where you did that. Yeah, I was... No, I don't know that I can get back in there. Shot? Yeah, I'm not sure what happened there, but it is what it is. Shot? Yeah. What is up with her fascia? Yeah.
Yes? Yes? Good, are we ready?
I don't need that. Just give me the laser. It's a lot of inflammatory tissue there. See it? See how red it is?
Yes, we do.
I need the laser on. So we're just about done here, Anthony. There's really not much disc material to remove. We're going to go to the piriformis release next.
Okay, I do have one question.
Go ahead.
We have a question from Diana on YouTube.
Hi, Diana.
Why does the MRI not improve post-op? Is it because the herniation is not fully removed?
No, MRIs are not that sensitive to see sources of pain. You've all been trained to believe that a herniation is the cause of the pain, but a herniation is not, or listhesis. So the things that you guys have been told that on an MRI scan are indicators of pain and pinched nerves and problems like that, they're not true. You're basically looking at the MRI at structures that you've been told are the cause of symptoms that are not the cause of symptoms. The actual cause of symptoms are much smaller than an MRI can see. And the MRI cannot pick up on what's causing pain. That's why so many doctors can't fix pain, because they have no idea what's causing it, because they're looking at the same things you are, and they're wrong about the source of pain. What you have to do is look at the structures on the MRI. You can make inferences about the pain, but you cannot see the source of pain. Therefore, when I go in and eliminate the source of pain, you won't see a change on the MRI because the source of pain is not something visible on an MRI. It's much smaller. Just for reference, this laser fiber is 1 millimeter. The resolution on an MRI is 5 millimeters. So the smallest thing you can really see on an MRI is about 5 millimeters. And remember, MRIs are averaging pictures. They're not an actual picture. It's an average of a bunch of structure. So, for example, if you have two hills next to each other, one is 500 feet, the other is 100 feet, the MRI will take both of those hills and show you a hill that's 250 feet tall. Yeah, so there is no 250 foot tall hill, but the MRI is not a real picture of what's happening. It just looks at data from electronic stimulation of electrons in the material that you're analyzing. For example, the spine, the disc, the bone, the muscle, the ligaments, the soft tissue. And it excites those electrons through the magnet, and then they relax. As they relax, they give off energy. The amount of energy they give off is proportional to the state of relaxation, the degree of relaxation, which is then determined by the chemical properties of materials around them. So you're not actually seeing a picture. The computer is recreating a picture based on the information of electrons releasing energy. So it's not a real picture, basically. And you guys are all everyone out there, all the patients think, oh my God, my doctor doesn't know what's wrong with me. They can't fix my pain. So I'm going to go on a journey of self-knowledge and learn myself about the spine and figure it all out. And then you guys go read all this nonsense that's out there on the internet instead of the truth. And you come up to your own conclusions that are incorrect. The truth is what I tell you, because I'm the guy curing back pain. And I know how to cure it because I know where it comes from. So I had to discover it myself. Nobody taught it to me. And I discovered it by treating patients the way I'm doing right now. And just figuring out where pain comes from based on the results of my treatment, which you don't have those results. I do. No other doctor does because they don't do what I do. So the experience I have of treating patients and curing their pain teaches me where their pain is coming from. And I've learned that over the last 30 years. So all your things that you think cause pain, like stenosis, pinched nerves. None of them do. You cannot see what causes pain on an MRI. I know what causes pain based on information I gather from the patient and from years of treating these conditions. I don't share enough of that information with you for you to be able to determine that. All right, thanks for joining us. We're getting ready to perform our piriformis releases. So we'll be back shortly.